Hello, everyone. I'm Dr. Marty Ross, and this is another Conversations with Marty Ross MD tonight. It's a Lyme disease webinar, which you create with your questions. And so at the heart of this is your questions, all right? So the way that you can participate, in addition to just listening to what the responses are and learning that way, is to write a question. Now, be aware, I may not get through all the questions tonight because we've got a lot of people showing up, but I do get through a lot of them. So where you can do that is over here on the right-hand side of your screen, down there at the bottom. Right at the very bottom there is a place that you can write your question to me. And the only thing I ask is, as you're writing your question, do not hit the enter key until you're done with the whole question. And the reason for that is each time you hit the enter key, it actually sends a whole question my direction. And from my side of the board, while I'm trying to manage these questions over here, it gets confusing to try to find multiple pieces of one person's question. All right. So I see some familiar names here tonight, and I see some new names as well, too. So I'm glad we have got a nice mix here. For those of you that are coming back, I'm glad to see you're back. I'm glad to see that you're getting some useful information that's helping you here. And for those of you that are new, I hope we come up with some useful information that can help you as well, too. During the webinar tonight, you're going to see I'm going to go to a couple resources during the webinar. One will be Treat Lyme by Marty Ross MD. That's my Lyme disease information site. There's a lot of helpful articles on there, and I'll probably point some of those out to you. But you can go back and look at tomorrow or later tonight if you happen to want to stay up a bit later. The other resource I'll show you is where my patients get their supplements, and that's just sometimes people ask me, what's a good place to find some of the things I recommend? So I'll show that to you as a source that you could use, and anyone could wind up using that as a source as well too. Okay, all right. So this webinar is being recorded, and if everything goes right, if it actually does wind up coming out okay, I will post that up, and you'll find it tomorrow morning at the Treat Lyme website. You'll find it either on the homepage, you can find it there, or you can find it on the webinars page. The other place you can find it is at my supplement store, Marty Ross MD Supplements, on the homepage. I post it there as well, too. And you can find it on Facebook. I usually upload it to Facebook, and that's at facebook.com/Treat Lyme. Okay, so there's plenty of places. If you happen to miss something here tonight, there's different places you can go to listen to that recorded version tomorrow. Okay, all right. And let's see here, what else? Oh, so this is the last webinar of this month. Actually, it's the last Wednesday of this month. But in August, I'll take the first Wednesday off. So I will not be doing the webinar next week, but we'll be back at it 2 Wednesdays from tonight. So let's see what we can get through tonight, and hopefully we can get some insights for all of you, okay? All right, so let me try to get started here. Take our first question. So during the webinar, I'll be posting questions, and those of you that are participating in the live webinar can actually see it, but it doesn't show up on the recorded version. So I'm going to read those questions so that those that are in the recorded version can hear it, okay? And then finally, one thing just to make everyone aware, I've got my air conditioning is on because actually it finally got hot in Seattle. Thank God it finally got hot in Seattle. But I have the world's loudest air conditioning. So if you hear something blowing on and off, it is my air conditioner, okay? So you'll hear that thing, you'll hear it come on and off. Glad to have it, but it is very noisy. All right, so let's take our first question here. Hi, Jennifer. Let's see. Hello, Dr. Ross. Thanks for these webinars. Can you please talk about the theory behind transfer factors? And specifically, can you talk about the Th1 and Th2 responses and the work of Dr. Holtorf? Also, what is your protocol for using transfer factors? Okay. So, Dr. Holtorf has a number of things that he does in terms of immune system, but I'll try to confine, but I think you're referring more towards transfer factors here. So I'm going to confine my comments to that, okay? So if I'm wrong about that, I'm sorry, but I just want to let you know that's what I'll talk about. So, all right, so everyone, transfer factors are proteins that are made by the detective part of the immune system, all right? So for the sake of describing transfer factors, I like to divide the immune system into 2 parts. There's a part I call the detectives and another part I call the army. Okay, this is a very basic description. You won't find it in a medical textbook, but it's a Marty Ross description. Okay, you got the detectives and the army. Okay, so the detectives can tell if an infection is there, and but they have to turn on the army part of the immune system to actually fight it. And they do so in a couple of ways. Number one, they release cytokines. All right, so many of you have heard me talk about cytokines before. The problem in Lyme is that cytokines get made in excess, and those inflammatory chemicals give you most of what we call Lyme disease symptoms. But in the right level, they actually turn the immune system on. in Lyme, they can be made in excess and actually turn off the immune system. But in the right amount, they kind of just globally turn the immune system, get it revved up, get it humming along, okay? All right, those detectives also make these proteins called transfer factors, all right? And what transfer factors do is they tell the immune cells what is the germ they're supposed to fight, and they target it to go after that germ, to rev up, to bring the right equipment to fight that one kind of germ, okay? So for instance, your immune system makes transfer factors against that cold virus that you had a while back, for instance, okay? Or if you've ever had flu, your immune system has made transfer factors against that strain of flu. If you have Lyme in you, your immune system has made transfer factors against Lyme. If you have the co-infection Bartonella, it might have made or should have made transfer factors against Bartonella, okay? So depending on what infections are in you, you could use transfer factors to try to turn on your white blood cells to better fight that germ, all right? So that's one thing, okay? And I'll talk about the various transfer factor mixes that there are, brand products that there are out there, all right? Now, Th1 and Th2 inflammation, let me just describe those to you real quick, all right? So there are certain groups of cells that actually fight infections. That's called cell-mediated immunity. They're the ones that go in and gobble up germs, all right? So there's things called macrophages, there's natural killer cells, there's a whole group of cells that actually attack germs, all right? Those cells that fight germs are called part of what's called the Th1 system, right? Then there's also this thing called Th2 inflammation. And what Th2 is made up of B cells that actually work with antibodies, okay? So it tends to be more of an antibody and B white cell driven system versus the Th1 is T cells that fight infection, macrophages that fight infections, natural killer cells that fight infections, okay? All right, so the Th2 tends to get turned on by things that we're more allergic to, okay? So that tends to be more of the allergy side of the immune system, all right? Now, both of these, Th1 and Th2, as part of their processes, these cells release different kinds of cytokines, so different kinds of inflammatory chemicals, all right? So that's where it becomes Th1 inflammation chemicals and Th2 inflammation chemicals, all right? Now, sitting above Th1 and Th2 cells are a type of cell called a T regulator, a Treg cell, okay? And some treatments are designed when you've got somebody that's got too much Th1 inflammation, which generally most people with Lyme probably have too much Th1 inflammation because unless they've got mast cell activation syndrome, which is kind of a heightened allergic, turned on allergic system, that's mast cell activation syndrome, in which case they might be more Th2, okay? But most people are probably more Th1, have Th1 problems, all right? It's just overly inflamed, all right? All right, so things that you could use that would help balance an overactive Th1 and decrease, and bring up not enough of a Th2, so where the balance is flipped to be too much Th1 inflammation. One of the things that can be helpful for that actually is to use something called low-dose naltrexone, all right? And in fact, I've just posted a new article about low-dose naltrexone. I'm not going to go into it right now, but we'll probably go into it later, or just you can read it. It's actually new and live on the site now. You'll find it in the immune system section, okay? In terms of using transfer factors, they're not necessarily going to alter Th1, Th2 responses in terms of the inflammation part of it, but they are going to help white blood cells that are supposed to be attacking Lyme to work better, or Bartonella to work better, okay? Or viruses if you have viral problems, all right? So Research Nutritionals is a supplement company that makes a variety of transfer factor products. One of the ones that I like using is something called Transfer Factor L+. And Transfer Factor L+ has in it transfer factors against Lyme, Bartonella, Babesia, Ehrlichia, Anaplasma, HHV6, which is a virus, cytomegalovirus, Epstein-Barr virus, and chlamydia pneumoniae and mycoplasma pneumoniae. So these are all kinds of infections that sometimes become part of the Lyme soup. Okay, so that's Transfer Factor L+. I usually have people use it as one pill twice a day. Another transfer factor that I sometimes will use if I have people that I'm treating for chronic virus infections to help boost their immune system against those is a transfer factor plasmic. And I believe it has transfer factors in it, about 16 or 17 different viruses. I always have to pull out the list, but it's a large number of viruses that sometimes can be active when people have a chronic Lyme disease, all right? There's also something called transfer factor enviro, and what transfer factor enviro does is it turns the immune system on to attack and get rid of various mold toxins, okay? Let's see. There's something called transfer factor multi-immune, and what that does is that actually doesn't really target the immune system to go after any one germ, but rather turns on the frontline defenses that we have that are supposed to fight any kind of germ. And those are something called natural killer cells. So it kind of just globally turns on those natural killer cells to be able to fight many kinds of infection, all right? So those are just some answers I have to your question. I don't know if I got into everything about Dr. Holtorf, because I know he's using amino acids now. He's using some other things to balance out the immune system. But those are the kind of approaches that I use in my practice. That answers your transfer factor. And then these days, in terms of regulate, trying to get down TH1 down, bring up TH2. I'm starting to work a lot more with low-dose naltrexone as a means of doing that. Okay? All right. Thanks for that question, Jennifer. Good luck to you. Actually, let me just do a quick screen share here. All right. Somewhere here is what I want to show you. Where did that go? Let's try here. Okay. All right. So this is back at the Treat Lyme site. And as I said, so on the homepage, if you're ever wondering what have I been putting up that's new, just scroll all the way down here on the bottom of the homepage, okay? And here is the latest article that I just put up here just a little bit ago. I just published it. It's a brand new version. I did have an article about low-dose naltrexone, but this is a complete rewrite. It's based on the newest science out there, and also based on my experience too. So you might want to take a look at this. I actually have this as a free article for now. You don't have to pay to read this article. Okay. All right. And probably later tonight, I'll be uploading a video that will go with that as well too. Oops. Wait a minute. There we are. Couldn't figure out which button to push to get myself back here again. Anyhow, hope that gives you some useful information, Deborah. And thank you for that question. Let's see here. That. Hello, SK. Let's see. How come you don't recommend oil of oregano on your website as an antifungal treatment? Are fatigue, vaginal discharge, and pimples on the face enough to suggest yeast overgrowth? These are my only symptoms from your yeast list. On a different note, does Doxy have an effect on Bartonella and Babesia at all? And do you have any non-pharmaceutical recommendations for Ehrlichia? That's a number of questions there. So I'll try to take them one at a time. Let's work backwards. Okay. I like starting at the bottom, working up. All right. So for Ehrlichia, my preference still is to use a tetracycline. I don't find the herbs to work as well. And usually about 2 to 4 weeks of a doxycycline, a tetracycline like doxycycline or minocycline is going to be enough to get rid of Ehrlichia. Ehrlichia is pretty easy to get rid of. Okay. All right. Let's see. In terms of Doxy, does it help with Bartonella Babesia? Yes. I would never make a whole Bartonella treatment based on doxycycline. I would never make a whole Babesia treatment based on doxycycline. But doxycycline, for instance, used to be one of the primary treatments we would use to treat malaria. And Babesia, as many of you know, is a blood parasite that lives inside of red blood cells, much like malaria does, okay? In fact, doxycycline still is a drug we will use when we send people into some malaria zones as a preventive, okay? And then in terms of what works on Bartonella, basically, most antibiotics that get inside of cells, that work from the inside of a cell, are going to be effective against Bartonella. So those would be the tetracyclines, those would be the macrolides like Zithromax, Biaxin, the fluoroquinolones, although I usually don't like using those anymore just because of so much tendinitis that happens with them. That would be like Cipro and Levaquin, for instance. Rifampin is another good one. Bactrim can be good. Those all get inside of cells. But as many of you know from my information and my information about how do you get rid of Bartonella, I prefer people being on 2 antimicrobials to treat Bartonella, whether those are herbal or whether those are antibiotic, prescription antibiotic, is 2 is going to work much better than 1 does. Okay. All right. All right. Then in terms of yeast symptoms. So the symptoms that can be suggestive of yeast. I know I have my whole questionnaire, and that questionnaire is probably better if you've never been treated for yeast before. Okay. But if somebody's in the middle of treatment and I find that they've gotten worse all of a sudden, their fatigue or whatever it is has gotten worse, and they've got more abdominal gassiness and bloating, or they have sugar cravings, or they have vaginal itching or vaginal discharge, or they suddenly start having a lot of acne problems, those are things that are going to make me think of yeast. Okay. So, in your situation, vaginal discharge, pimples on your face, and fatigue, yeah, that would be enough probably. I mean, I'd ask you a few more questions, but just based on the way you frame it there, that's probably enough to say there's probably intestinal yeast overgrowth, okay? So what happens with yeast is they release toxins in the intestines, and those toxins interact with the skin, leading to easier pimples, all right? And that seems to occur in people that have a genetic predisposition for that happening, actually. So that's what the science tells us on that. The other thing that happens if you have too many yeast is they trigger the immune system to make too many of those inflammation cytokines that I was talking about earlier tonight. And if you get too many of those cytokines, you start having more fatigue. That's one of the big symptoms of having too many cytokines is the fatigue, okay? All right, in terms of oil of oregano. So I don't list it as a single agent, although you could use it that way. But if you look at one of the combination products that I recommend, and I think I list out the ingredients in my articles, is something called Phytostan. And Phytostan has in it pau d'arco, caprylic acid, rosemary oil, and I believe, maybe it's thyme oil, not oregano. Any of the volatile oils, just so you know. Yes, I don't list it there. It's just I just didn't. I mean, it doesn't mean it doesn't work. But any of the volatile oils, so volatile oils would be oregano, thyme, rosemary, clove oil can be useful. Those are things that can kill yeast as well too. Generally with the oils, though, I don't like using an isolated oil. I usually like using them in combination with something else that's going to kill yeast at the same time too. Okay? All right. So I hope that answers your question, SK, and thank you for that question. All right. I'll do a quick screen share here, everyone. All right. So back here at Treat Lyme again. All right. So I just mentioned a few things here. So to get around the Treat Lyme site, click on this Start Reading button, and you're going to see this whole menu drops down. These are basically the topic areas that I write about, all right? So in terms of infection treatment plans, you can go here, and I lay out different ways of approaching things, okay? So a Lyme disease antibiotic guide, all right? That's my main approaches to treating Lyme. This is going to be probably going an update over this next week. So if you're looking for the possibility of more updates coming, yeah, I'm back focused on writing for the site again. So you'll see an update probably coming to that one. I bet by next week this time I have an updated antibiotic article for you on that. Okay, in terms of Bartonella, take a look here. This is where I talk about the various herbs and prescription combinations. Babesia, kills Babesia. This is where I talk about that. And then in terms of my ideas on how do you get rid of yeast, take a look at my article called Kills Yeast, a Brief Guide. I review some herbs. I review some prescriptions in this article as well, too. Okay? All right. So I hope that answers everything. And I just want to show you everyone those resources there. Hello, Cindy. Let's see. Do you trust muscle testing? No, I don't. Well, that's not true. It depends on who's doing it. There are some good testers out there, but in general, I don't trust it. I generally don't trust it in terms of making a diagnosis. I know there are some people that claim that using muscle testing, they can tell whether you have Babesia or Bartonella in you. I just find that is very inaccurate, okay? But in terms of testing what your germs might respond to based on the energetics of the thing that a person wants to give you and how it interacts with your body and the germs in you, I think that energy testing, muscle testing, energy testing that way might have some usefulness depending on the person. So testing is only as good as the tester, okay? So even though a lot of people out here have been trained by Dietrich Klinghardt in the Seattle area to do a type of energy testing called ART testing. There's lots of them around here in the Seattle. Dietrich has trained a lot of people. there's only a handful, I think, that know how to do it well. That's just been my experience, because I've had to take on a number of their patients after their testing wasn't working. That's not to say his system isn't good, but I still think it's always about who the person is. Okay. All right. Thanks for that question. Hello, Brenda O'Seal, Dr. Ross. Let's see. Can you please tell me how often Lyme spirochetes replicate? I tested positive for Lyme and have many neurosymptoms, but I have only clinical symptoms for Bartonella. If my symptoms slowly increase over several years, does this mean I have neurolyme and not Bartonella? All right, so Lyme replicates about every 4 weeks. Some people estimate maybe even up to every 8 months. Okay, it's slow growing stuff. Bartonella, on the other hand, tends to replicate about every 24 hours, all right? Now, the thing, what that really means, it's not so much about how quickly your symptoms grow, it's more about how quickly the germs are going to respond to antibiotics, okay? So Bartonella, because it replicates more quickly, actually responds more quickly to antibiotics. And typically, when you have Bartonella, if you get on Bartonella antibiotics within about 3 to 4 weeks, you'll start seeing improvements in those Bartonella symptoms if you're on the right combination and if you really do have Bartonella, okay? All right, so in terms of neurologic symptoms, Bartonella can give you neurologic symptoms, okay? So I know the way that I read this question is you're thinking that I think the way I read it is is that the neuro symptoms you believe are part of Lyme, but I just want to tell you, they can be part of Bartonella too. So Bartonella can give you neuropathies, can give you confusion, can give you seizures, can give you a whole host of neurologic symptoms, okay? Bartonella can do that, okay? Bartonella also is known for pain in the soles of the feet. It's known for triggering a lot of psychiatric issues like ongoing pervasive anxiety, sometimes depression. It can give people restless legs, which is a feeling of things crawling around in the legs, so you constantly got to move them around, okay? It can also give bladder instability, something called interstitial cystitis, which is inflammation of the bladder lining, and that inflammation leads to instability of the bladder, so people feel like they got to pee frequently, or they actually do urinate frequently, or they have burning on urination. Okay, people with a lot of neurologic hypersensitivities, like lights, touch, and sound, sometimes can be part of Bartonella. Increased day sweating sometimes can be part of Bartonella. A rash that looks like scratch marks or stretch marks in areas that you would not expect to have stretch marks sometimes can indicate Bartonella. So there's a whole host of symptoms that look like Bartonella, but actually neurologic is one of the big ones. So anyhow, I hope that gives you some useful information there. If you're looking for an article that I've written about Bartonella symptoms, take a look at back at Treat Lyme. So there's an article, there is a section I have about how to diagnose, where we are here. This is right there. And the article about how do you diagnose Bartonella babesia, it's all based on the symptoms. The testing is not reliable. That's this article right here. It could be Bartonella babesia, the symptoms and signs. Okay, so I walk through all of that in this article. All right. All right, back here again. Thanks, Brennan. And good luck to you. Hello, Jackie. Let's see. Hi, Dr. Marty. I was advised to see a neurologist for my disability case. I met with the functional neurologist and informed him 25 years Lyme, Barton neurologic symptoms. He said I have adrenal fatigue, which you mentioned during my consult. Also fight or flight and dysautonomia. He explained, but I do not. Let me see if I can find the second part of that. Understand. I do have the symptoms. I assume these 3 are from 25 years of untreated infection. He has great reviews, but I do not feel he is a Lyme expert. He said he could get my immune system strong through therapy with him, home exercises and supplements. I did not want to challenge him, but I do not believe something. Let's see here. Jackie, I got to see if I can find the rest of your question here. Just a minute. See, I do not believe I could get well so quickly as implied with 12 weekly sessions. I told him that I'm going to begin a regimen with you. Do you feel I benefit from his treatments along with your recommendations? I was hoping he would help with the 3 conditions so I could have energy and less pain sooner, but now I know I need you. Jackie, just so you know in the future, you can write your questions to me through my secure email system and not have to broadcast what's happening with you clinically out to everyone, okay? So I think during the visit with you, we set you up on a secure system called UpDocs. Feel free to write to me through UpDocs. It's probably a better way to communicate so that you don't do it this way, okay? All right? So the only thing I want to say to you is, I think that given if you have a lot of neurologic symptoms, there are some things that can be done with functional neurology to help with the neurologic symptoms. But I do think that this person in particular may be missing the underlying problems with having Lyme and co-infections. And so I think it would be, from what you just briefly described here, it'd probably be okay to mix plans together. Okay. But I'll leave it at that. I'd prefer that actually if you were to write to me through UpDocs, where I'd better be able to respond to you. Okay. All right. And good luck to you. So everyone, what Jackie is referring to is I do a type of visit called a one-to-one consult, which is still available at this point. I'll just show it to you real quick. So if you're thinking you might want some input from me about what to do with your care, click on this private consultations tab. And this describes a service where I can give you advice, but I still suggest you have another physician that you work with, especially if you need prescriptions or if you need tests to be ordered, okay? So read through the whole thing about how it works. There's actually a disclaimer here that I need you to read. It basically says that this visit is limited because I don't get to examine you, okay? But if you are interested, fill out this information form here and get back to us, okay? All right. All right. Let's see here. Hello, Ken. Let's see. I was diagnosed 1 year ago. Ongoing issues are insomnia and mental fog. Ken, let me see if I see a second part to your question here. Ken, I don't see any more to your question there, so I don't have anything to answer. Sorry about that. Hello, Marie. Let's see. Hi, Dr. Ross. Thank you for all you do. What do you recommend for the feeling extremely weak? Positive for Lyme, Bartonella, and probably Babesia. Thank you. So I'd like to ask you a lot of questions to find out a little bit more information about those symptoms. So I'll just give you some general comments, okay? So if by weakness you mean your muscles just don't seem like they have much energy or strength, then what I would do is probably do some work on repairing your mitochondria, okay? Mitochondria are the cell energy factories, okay? If, on the other hand, by weak, you mean you are just tired, which is different than muscle weakness, that would mean that I would have you make sure you're doing all the steps that I recommend to support yourself during a Lyme disease treatment in the Ross Lyme support protocol. And I'll show you those essential steps. And if you're already doing those and you're not getting better, then I would consider doing mitochondrial repair. Okay, so let's talk about mitochondrial repair first. So the mitochondria are energy factories that are found inside of every one of our cells. And we estimate that there's 300 to 400 mitochondria in a cell. Inside mitochondria is where sugar and fat are burned through a bunch of chemical reactions to create cell fuel, which is something called ATP. Okay. All right. Now, because in Lyme, because of ongoing injury created by the germs, there's an overproduction in the body of oxidizing agents, and those oxidizing agents can damage the membranes of the mitochondria. All right. And mitochondria are susceptible to injury from it because they don't do a good job making antioxidants to counter that. And so the membrane covering the mitochondria gets injured, makes it so that it can't take in fat to the inside to be used as an energy source. Also, it causes, when that covering gets injured, that decreases its ability to give electrons into a bunch of the chemical reactions. And so you have sluggish energy generation of the mitochondria of the chemical reactions. They don't take place well, so you get sluggish energy generation too. Okay. So what you want, and a sign that can happen especially is muscle fatigue, because muscles will burn through their, you need to have functioning mitochondria for muscles to keep working well. And they usually will store up energy, but if they're so depleted, they're not going to store it up at all. They're going to exhaust anything that they might have made recently. They're going to exhaust it quickly, and you're going to get weak really fast. Okay. All right. So what do I like to do? Well, I like to repair the covering. And what I like to repair the covering is a supplement called NT Factor. NT Factor is made up of a bunch of fats that make up the covering of the mitochondria, microscopically wrapped in a way that gets them absorbed, okay? And NT Factor is one item that is found in a product called NT Factor Energy by Research Nutritionals. You can also find it in another one of their products called ATP Fuel. And NT Factor also is found as separate NT Factor. Right? For instance, Allergy Research has an NT Factor, for instance, okay? What I'd like to do is to have people take 750 milligrams, a 750 milligram pill of NT Factor, or the NT Factor Energy, as 2 pills 3 times a day for 2 months. And then after 2 months, I'll have them decrease it down to 1 pill 3 times a day. Okay. Now, there are studies done looking at the NT Factor component of NT Factor Energy. And it appears by those studies that there are average energy improvements of 40% by 2 months of using the NT Factor. That's pretty impressive, actually, okay? Other things that I like to do in addition to that is I like people to be on a good antioxidant. And what I like to use for my antioxidant is a glutathione. And I like it to be a liposomal variety of glutathione. So liposomal means it's microscopically wrapped in fat to get it absorbed. And the product I like for that is something called Trifortify, also by Research Nutritionals. And I have people usually take a teaspoon of that 1 time a day. The other things I would consider adding to, so those are kind of the essentials, okay? 2 other things you might consider adding to that would be the something called coenzyme Q10 at 400 milligrams twice a day. The reason I do that, it actually helps carry the electrons around the mitochondria. And then finally, if you are not a red meat eater, if you don't have red meat periodically, then you probably should be on something called acetyl L-carnitine. Carnitine is a protein found in meat that acts as the transport vehicle to carry fat from the outside of the mitochondria to the inside of the mitochondria, okay? And so that would be something to think about as well, as if you're primarily a vegetarian, you want to do that, all right? So my basic protocol to repair mitochondria is NT Factor, glutathione, coenzyme Q10, and if you're a vegetarian, have some acetyl L-carnitine, all right? So let me do a quick screen share here. All right, so this is back at the Treat Lyme site. Okay, so in terms of energy, take a look at my chapter called Energy and Fatigue. And the article that I have written about mitochondria that gives you all the steps to repair the mitochondria is this one called Power Up, Energy and Mitochondria. Okay. All right. And then in terms of basic steps to fix your energy, these are the essential components that are pretty much found in my treatment protocol. So I'll just show that to you here real quick. All right. So this is the Ross Lyme Support Protocol. Includes all the basic steps I do with patients in my practice that helps get them well. So number 1, get sleep. Okay, so getting sleep is critical. I give you some options on what to do here with that. But if you're feeling weak or tired, you want to make sure you're getting about 7 to 9 hours of sleep a night. Okay. Number 2, a good diet when you have low energy is a paleo type diet. And I give that to you here. I give you an option of how to do it here if you click on that link, okay? Number 3, make sure you're doing everything you can to lower cytokines. And I talked about cytokines tonight already. Cytokines in excess, which happens in Lyme, are what are going to give you a lot of your symptoms, all right? Number 4, make sure you're doing something to help your body deal with stress. Those are called adaptogens. I like ashwagandha. And given the weakness and tiredness I think you're expressing, I definitely would be on this ashwagandha. Number 5, figure out if you got low hormones and fix those if you do. Be on a good multivitamin. Detoxify, and some minimal things you need to do to detoxify are be on glutathione. And those are kind of the essential steps. Make sure you don't have too many yeast in you too. I talk about that here, okay? So that may sound like a lot, but those are the things that are going to keep you with good energy, keep your immune system working well. And I consider those to be the essential steps that anyone in their Lyme disease treatment should be doing to get well, okay? All right. Thanks for that question, Marie. Good luck to you. Hello, Val. Let's see. Dr. Ross. Hi, Dr. Ross. Husband being treated for chronic Lyme, Bart, Babesia parasites. Treated with doxine rifampin 3 years ago for anaplasmosis. But after... Let's see. But after recent tests show anaplasmosis active again, what antibiotic or herbal regimen would you suggest? Thank you so much for these webinars. Okay. So, Val, I want to make a distinction about testing showing it's active again. Okay. So if they did antibody testing, they might have measured something called IgM or IgG antibodies. What I want to let you know is once IgG antibodies are made, they're going to stay elevated. And so just because they're the memory of the immune system. So if your doctors did an anaplasma test and they saw that he had elevated IgG antibodies, that just may be because of the old infection, okay? The other test, though, that could have been done, and this probably would have had to have been done from a lab called Armin Labs, I think Armin does this, is to do a type of test called an ELISpot, which measures whether your T white blood cells are reacting against infection. And if you had an ELISpot test, he had an ELISpot test that came back positive, then that does mean active infection. But I doubt that this is a relapse. It is possible he picked up another anaplasma infection, okay? Because again, it's my opinion that when you get anaplasma out, you get it out. Now, I do agree that Lyme relapses can occur because Lyme is an infection we probably never get rid of. If you start treating Lyme at a year or more after your infection, I don't think we get rid of it, okay? I think the best we do is knock the germ load down. We learn how to cohabitate with it, all right? Bartonella, I think we can knock out 95% of the time, 5% of the time we don't. I do believe we can have Bart relapses. But I'm not a big believer in anaplasma relapses, okay? All right, so I would use doxycycline again. I doubt that this is a relapse. I would just go back and use doxycycline probably for a month, okay? 100 milligrams twice a day. All right, good luck to you. Good luck to your husband. Bear with me here a minute. I'm just trying to clean these comments out. All right. Hello, Lisa. Let's see. Hi, Dr. Marty. What are your thoughts on Dr. Rawls' herbal protocol and live blood analysis? I'm also about to try a 2-month high-dose Dapsone protocol because after 6 years, nothing has worked. Besides being a harsh drug to withstand, any thoughts about Dapsone? All right. So it's interesting. I've actually just spent some time looking at Dr. Rawls' books and his protocol as well, too. So I think like I said, I think he's got some good stuff, and I think that it's not going to be for everyone. So I would just start by saying that. So Dr. Rawls, in terms of his approach, tried to create a number of formulas. He didn't try to have people take too many things to confuse them. And he tried to put as many of his germ killers in one product and as many of his Lyme support herbs in another product to try to make it so you're only taking 4 kinds of pills, for instance, okay? So he's simplified it. The trouble is, it's very much a one-size-fits-all approach. And it's not as simple in Lyme as that, okay? So for instance, when I look at his herbal formulas, as you know, one of the essential things that I say people should do is lower cytokines. Even if you look at Buhner herbs and some of his recommendations, especially with knotweed, which can kill things, but knotweed also lower cytokines too. To a degree, they do. Lowering cytokines is an essential part of a Lyme treatment, and Dr. Rawls doesn't really deal with that much at all, okay? His herbal formula, which he has everyone go on, does not do anything for Babesia or Bartonella. So if you happen to have a Babesia Bartonella infection, his protocols don't have antimicrobials that I would think of as targeting those, okay? And essentially a lot of it is based on just the Lyme portion of Buhner herbs. So these are ideas that Dr. Rawls didn't necessarily develop himself. He's done a nice job marketing it. His daughter has done a nice job marketing. Behind his company is actually his daughter who's running the company down there, it looks like to me. But I don't think there's enough room in there to individualize for what your situation is, okay? Could it be effective at killing Lyme? I think for an average person, perhaps. But if it's a person that has other co-infections, it's not going to be useful enough for that. And I don't think it would be useful enough for that. And I don't see enough room in his protocol to add in things to help support you when the core protocol is not working, okay? So for instance, if you take a look at my protocol, I kind of have a starting protocol, which is sleep, be on an adaptogen, lower cytokines, kill various germs, including yeast. And I'd say that needs to be handled up front. Rawls doesn't appear to have anything I see that deals with treating yeast at the beginning of a treatment there as I reviewed his things, okay? And then if you look at my writings on Treat Lyme, I say these are some other things to add in if this core protocol isn't working, like look at low-dose naltrexone, and I tell you how to do it. Or add biofilm treatment, and I say, here's how you do it, okay? So it's the Rawls protocol, I think, is more limited than many people might need. I think for a certain type of patient with just pure Lyme, it might work. And the reason it might work is he does have good antimicrobials against Lyme. In terms of having needed a lot of detox and anti-cytokine approach, I think what he has in there is going to be good enough. I don't think it's going to be good enough for a more complex person, okay? That's just my take on it. So anyhow, those are your thoughts there, okay? In terms of Dapsone, so I wonder if what you mean by high-dose Dapsone is I recently have heard, although I haven't talked to him, is that Dr. Horowitz now is starting to experiment with having people do quote-unquote high-dose Dapsone. All right, so let me just talk about what I understand that to mean. So Dapsone is a drug that has been shown to be useful in leprosy. And leprosy is a germ that has the ability to develop what are called persister cells, okay? And it's been discovered now that Lyme also is a germ that has the ability to develop persister cells, all right? So what are persister cells? Well, persister cells are forms of Lyme germ that will develop after a germ has been on antibiotics for a while. And in fact, there's been studies done that were published out of Northeastern University a number of years ago. And there have been some more recent studies done by Ying Zhang, Dr. Ying Zhang out of Hopkins, who is a tuberculosis researcher, is now doing Lyme research because tuberculosis also has persister cells. And what it appears persisters are, according to Northeastern studies, when you're on antibiotics for a while, about 20% of spirochetes and about 20% of cyst will transform into a persister state, okay? And essentially what happens with those cysts and those spirochetes is they slow their metabolism way down and they just ignore the antibiotics, all right? That's not the same as drug resistance, because if you wake them up, they'll start responding to the drugs again, all right? The other thing that happens probably in persister states is a lot of the germs move into biofilm communities, and a number of them will move more predominantly into cyst forms, okay? So that's what I call persister state or persister Lyme, all right? So knowing of this more recent work, Horowitz, about a year and a half or so, 2 years ago, set up a study involving 100 patients in his practice where he put people on Dapsone because Dapsone's been shown to be useful against leprosy, which has which has persister cells as well too, all right? And so he enrolled everyone in his study, and then he had pretty good results. At least on the surface, it looked like good results, okay? So let me just break that down a little bit for you. So these are based on his published study of 100 people. And in his protocol, everyone was put on Dapsone. And in addition, they were put on cefuroxime to treat the cell wall of the germ. They were also put on some various intracellulars. Those could have been macrolides like zithromax, Biaxin. Some of them might have been on tetracyclines, and a number of people also placed on rifampin. Okay, so the core part of the protocol looks like it was cefuroxime, Dapsone, some intracellular of a tetracycline or a macrolide, and then rifampin. All right, that's kind of what the core program looked like, although there could have been variation from patient to patient. All right, so his studies was published, and it showed that there was improvements. I think it was 57 or 59% of people had improvement. Now that looks great. And Dr. Horowitz has been a big proponent of his treatment too. Okay, so he's been out enthusiastically promoting Dapsone. The problem is when you get into the details though, and he published his details show, he took a bunch of the symptoms and then he broke it down by about the degree of improvement that they had. And the degree of improvement, when I look at the math on it, it looks like it's about a 15%, 10 to 15% improvement in symptoms on average, all right? Now, don't get me wrong, 10 to 15% when you've been struggling with Lyme for years is good, all right? But it's not the miracle cure for most people that, I guess that maybe it looks like some would promote that it can be, okay? All right? Now, what I understand is more recently, Horowitz has been looking at the idea of having people take a Dapsone dose that is a 200 milligram Dapsone dose. At least that's what I understand, all right? So in his old protocol, he would try to get people up to 100 milligrams. In his new protocol, he's trying to go up to 200 milligrams to see if it will work better, okay? Because I think he was finding that there were people still relapsing even after his Dapsone protocol. Well, I got to tell you, and I think it's a hard drug. I would need to know more about what he's specifically doing, but I would think it would be very hard to get up to that dose. I would think that people would have a lot of increased side effects, probably severe die-offs getting there. I understand from talking to a patient that's tried it before that his thoughts are that just try to get through it for a month or two and that generally things will get better. But it just leads me to say that I don't know about Dapsone. I think it's another tool in our bag. I don't think it is the it tool for everybody. And I know Dr. Horowitz is very enthusiastic about his Dapsone, and I'll be interested to see what his study shows. I know in my practice, about 30% of people had to stop Dapsone even at lower doses because of side effects. We just couldn't get through it. And in his presentation that he made at ILADS in November this last year, I think he said it was about 30% that had to drop out of the study in his practice as well too. So it's a hard drug. It'd be interesting to see if you can do that. I don't know if it's going to give long-term benefit or not. Sometimes giving more may get better killing. It doesn't mean it always will. So it'd be interesting to see what kind of results he gets with that. But I would be a little skeptical, actually. Okay? All right. So that's a lot I said there, but that's what I know. All right. Thanks for that question, Lisa. Oh, hello, Kayla. I didn't pay attention to what you wrote there. All right. Good to see you here. Bear with me here. Got some people asking, did we start yet? I assume that's because I got to the room here just a little bit late. All right. Hello, Kit. Let's see. I'm having a hard time figuring out if I'm herxing or experiencing Lyme, Bart, Babesia symptoms, or medication side effects. I'm having horrible weakness and fatigue. If it's herxing, should I stop medication for how long? What can I take for the quickest strong relief if it is a herx? Okay. So Kit, let me just make a general comment, okay? Maybe this will help answer that question for you. All right. So a herx is the reaction that happens near the beginning of a new antibiotic, or if you change antibiotics, or if you increase antibiotics, okay? It is increased killing that results from changing something that kills the germ, all right? So a herx, as you heard me talk earlier tonight, when you have Lyme disease, immune cells will see the germ and make cytokines. And in Lyme, they tend to make too many cytokines because the immune system doesn't do a good job, and it keeps trying to make more and more cytokines to turn itself on. And eventually, those cytokines get made in excess. And in excess, those cytokines disturb your sleep centers, make it so you can't think, make you hurt all over, interfere with correct hormonal function. I mean, it's the increased cytokines that create the mess of Lyme disease, okay? Now, so all your symptoms are really cytokine symptoms initially in Lyme, okay? Now, when you start killing germs, or you get an increased kill of the germs because you started something new, what happens is the immune system sees all those dead bug parts and makes more cytokines. So a Herx usually is the worsening that occurs within, say, a few days to even a week or so of starting a new antibiotic regimen. Okay, that's a Herx. Right now, sometimes people incorrectly label a Herx as worsening that occurs even after they've been on an antibiotic regimen for a while. Okay, so let's say you were doing really well for a while and then you suddenly started doing worse. That's not a Herx. There's something else going on that's triggering those cytokines. Okay, and generally in my practice, what I have found is about 80% of the time that somebody gets worse after they've been doing better. Think yeast. All right, because yeast, if you start developing too many yeast in your intestines, they trigger the immune system to make more cytokines, all right, which can make it look like all of your Lyme got worse, all right? So if that's your situation, questions that you would want to look at is, are you more gassy or bloated? Have you had increased sugar cravings? Any vaginal itching, vaginal discharge? Sometimes people with yeast will tend to get a lot more acne and skin rashes as well too, all right? Okay. So if it is a Herx though, I have written some recommendations about what to do for a Herx. I have a whole article. It's actually available for free. I think it's one of my free articles. It's on a Herxheimer reaction. But the main thing, and I'll show that to you here in a second, but two things I usually have people do with a bad Herx is, number one, if it's bad, you may need to stop or cut back your antibiotics. But before doing that, what you might want to consider doing is get on some curcumin, 500 milligrams, and do up to 1,000 milligrams 3 times a day, okay? So curcumin gets inside your white blood cells and blocks cytokine production, okay? All right. Number 2, get on some glutathione, some liposomal glutathione. And what that does is that will help clear out toxins that are triggering some of those cytokines. But as a potent antioxidant, what it does is it decreases oxidizing agents in your blood that are telling your white blood cells to make cytokines, okay? So glutathione can acutely turn down a bad Herxheimer reaction. All right, so let me just do a quick screen share for you and show you that. All right, so back here at the Treat Lyme book, or at Treat Lyme, I should say. I used to call this the Treat Lyme book. Take a look at there's a section, well, you could look at it under the chapter called Herxheimer and Cytokines, or I believe it's in my free reads page. I guess it is not my free reads page. So yeah, you'll have to take a look at so I have the full article about Herxheimer reaction. You'll find it here in the Herxheimer and Cytokines page. And it's this article here, where I review both what a Herxheimer is in good detail, and I tell you what to do. I do talk about the curcumin and glutathione. I also have some other recommendations in here too, but so that's where you'll find that article. Okay, all right. Good luck to you, kid. Hello, Ava. Let's see. I became a member last week after your webinar. What an outstanding resource. Thank you. I'm glad to hear that. I think it's an undiscovered resource right now. I'm trying to figure out how to get more people aware of it. So thank you for that. I appreciate that. And Ava, just so you know, I'm devoting a lot more time to writing new material and getting more updates to it too. So that's good. Let's see. Last week you mentioned the Nagalase test. Have you gained consensus from patients' feedback about the effectiveness of GcMAF? I'm aware that it can be ordered from Japan, New Zealand, and the UK. Do you have any thoughts of which source you have heard is most effective, and dose frequency for self-injection or IV, and for what duration? Is there concern the injectable is derived from humans? Thank you. All right. So first of all, let me kind of talk about terms for everyone to make sure we're all on the same page here, Ava. So what Ava's talking about, Nagalase is a test that I use that some would call experimental. It's an enzyme that is made in the covering of viruses. And so if you have increased amount of viruses in your body, you would have increased Nagalase levels, okay? So the problem with virus infections is a lot of doctors will try to determine if you have too many viruses living in you to see if they're a problem by measuring antibody levels. And the antibodies that are generally elevated when somebody has viruses living in them are IgG antibodies, okay? But the problem with viruses is we live with virus, we cohabitate with them, all right? Healthy people have viruses living in them, and it doesn't cause them problems because their immune system keeps it under control, because their immune system makes IgG antibodies, all right? So just having elevated IgG antibodies does not mean one of these viruses that are common even in healthy people are causing the person with Lyme a problem, all right? So those viruses, for instance, would be the Epstein-Barr virus, which is the monovirus, HHV6, which is human herpes virus type 6, something called parvovirus B19 can be one, something called cytomegalovirus. Those are common viruses that some people think could be involved in fatigue and in Lyme disease causing symptoms. But again, it's controversial because they may just be background noise, all right? So there was a study done back in 2012 published by a researcher named Montoya out of Stanford University. He's doing some pretty interesting research on chronic fatigue syndrome these days. And he found that if people had marked elevations of HHV6 IgG antibodies and Epstein-Barr virus IgG antibodies, that he postulated that meant they had chronic active viruses, that they were a problem. And he put all of those patients on a prescription antivirus medicine called Valsite, and he found an overwhelming number of those, more than half of them, had good improvements in energy by being on Valsite. And so that was taken as some proof that maybe elevated IgG antibodies does mean that the viruses are active and they're hurting you, okay? But I would say it's still controversial. We really don't know, all right? So where Nagalase can come in is it's made by the covering of viruses and can indicate if you have an active viral load in the body. Do you have too many viruses? Now, it's not specific for any one virus, but it can indicate it, okay? Now, Nagalase, what it does is made by viruses. It also can be made by cancer cells as well, too. And when it comes back, what a Nagalase does is it breaks a sugar group off of a chemical called GcMAF that is responsible for activating a type of white blood cell called a macrophage to fight viruses and cancer, okay? So there's these white blood cells called macrophages, and they have to be turned on by GC, macrophage activating factor, which is also called GcMAF, all right? And that protein has a couple sugar groups hanging off of it, and the Nagalase breaks one of those sugar groups off of that GcMAF, and it makes it so it will not turn on the macrophages, all right? Okay, so there are places that you can buy GcMAF and give it by injection. And for a while here in the States, I was doing it, and a number of my colleagues were doing it too. However, our Food and Drug Administration got involved, and the general consensus here in the States now is not to touch the stuff. As a doctor, I wouldn't touch it. There is the possibility of criminal issues, et cetera. Our FDA has taken a very, very negative stance on it because of a lack of scientific proof, evidently, and for other reasons. So I guess what I would say is I know I probably have written a little bit about it. I'm not using it anymore because of risks that are involved in it more. Ones of the FDA looking very negatively on doctors giving advice about this and actually using it in their practices. So I'm sorry, I'm not going to be able to give you specific comments on that, okay? My preference these days to go after chronic viruses is if somebody does have elevated Nagalase levels is to actually use the antiviral protocol that I think you saw in that article, which is to use work up to 1,500 milligrams a day of olive leaf extract. Try to be on something that stimulates the antiviral part of the immune system. I usually use reishi mushrooms, 400 milligrams 3 times a day. And then I might add in something called transfer factor plasmic that I mentioned here earlier tonight too. Okay, all right. Sorry about that, Dave. I just can't give you something more specific because of restrictions placed on me by my Food and Drug Administration. Okay, and good luck to you. Hello, Janice. Let's see. Feet began to burn, vivid red and swell. Swelling continued past knees. Legs became covered with red rash with individual tiny red bumps. Natural doctor, golden seal, now welling, red to purplish black color on lefts. Is a few inches below knees and a few inches above ankles. This is not regular edema. How do I, if this is going to go away? So, Janice, I don't know. This is one of those things that I would want to look at your legs to see a little bit more. I would need a picture because there's a number of things this could be. It could even be something called venous insufficiency, for instance, where the veins just stop bringing blood flow out of the legs enough, and it can give you purplish, reddish coloring. You can get ulcers from it. And so I would need more information. I would need to see a picture. I need to see your scan on this one. Okay. Sorry about that. All right. Thanks for that question. Hello, Fran. Let's see. I've read that BART and Borrelia can cause disruption of squamous cells in the skin, leading to cancer. Do you know of any such relationship with these pathogens and lung squamous cells, or how would I research this? Google finds next to nothing. Thanks, Dr. Ross. So I'm not aware of any cancer risk. The only place that I would know to look, I would not do Google searches. I would probably look at the True Research database, which there is. You would go to a place called PubMed.com, PUB.com. You would be literally researching research papers, but you would be able to see at least if anyone has found there is a relationship. So you would go there, and the PubMed search bar that's at the top, you would type in cancer and Bartonella and just see if anyone's found a relationship. If there's anyone's written an article about that, okay? Same with Borrelia. That's what you would wind up doing, okay? All right. Good luck to you, Fran. So it's PubMed.com, PubMed.com. Hello, Nina. Let's see here. Hey, Marty. So grateful for your help in webinars. So when treating for Lyme, when I've come out of remission, is it okay to pulse antibiotic treatment? 2, if you suspect Lyme in dogs, would you feel comfortable treating with herbal antibiotics? If so, which would you use and for how long? In terms of dogs, I don't know what's safe. So, simple things that we take for granted as humans can be harmful in a dog. I mean, like chocolate, for instance, they can't handle the caffeine of it, right? So I don't know. I don't know what to advise you on that. And I'm not a veterinarian, at least not in this lifetime. I'm not. So I don't know how to advise you. I don't know anything about safety of these things for dogs. In terms of, how do you use your antibiotics when you need to be treated again, whether they're herbal or prescription? I mean, you can use it as a pulse or you could use it continuous. I don't think there's any reason that says one over the other is better. The idea with pulsing, at least according to the research that came out of Northeastern University that I was talking about earlier on persisters, their experiments showed that if you do pulsing, that's one way to get rid of persister cells. Maybe you got worse because there were some persister cells hanging around. I don't know. But I think you could go either way, actually. Okay. All right. Thank you. Let me just show you. So I know I've mentioned persisters a number of times here tonight. Let me just do a quick screen share here. Okay, so back at Treat Lyme here. I'm going to take a look at a chapter. It's called Can't Get Better, Do This. Okay, so these are the approaches that I suggest people start considering if they're about 6 months or so into their treatment and they're just having a hard time getting better. All right. This is after doing all the stuff that you would do Ross Lyme support protocol. Okay. All right. So the overview article is this one here, but take a look at this article called How to Treat Persister Lyme, What Works. Okay. And in here, I lay out some different ways. I talk about what a persister cell is. And this is one that is going to require a prescription. But I review the Northeastern studies that showed that there are persisters and that pulsing might work. I look at Ying Zhang's work out of Hopkins, where he has shown that certain combinations of antibiotics work on persisters. And I looked at Horowitz's work in terms of his Dapsone, and I review all of it here, okay? So you might want to take a look at this. This talks about approaches to treating persister cells, some that I use in my practice that I have found useful, okay? Good luck to you, Nina. Hello, William. Let's see, how to treat persistent sinus infection. So I would ask you a lot of questions, first of all, to find out what you mean by persistent sinus infection. But sometimes what needs to be done is you just need to get a CAT scan of the sinuses to make sure that what looks like a persistent infection isn't allergies or bacteria infection. And there's a different way that both of those will look on a CAT scan of the sinuses. And so that might be something for you to consider, okay? I can't answer more specific than that because I don't know what actually is happening with your symptoms. There's certain types of symptoms that make me think more bacteria. There's some symptoms that might make me think more allergies, and they both would require different approaches, actually. Okay? All right. Good luck to you, William. Hello, Heather. Let's see. I have Lyme, Bartonella, and parasites. I love Biocidin LSF, but will it take care of Lyme co-infections? If not, what herbs can be combined with the Biocidin to cover my bases? It's a good question. You know, as I look, so Biocidin, everyone, is an herbal complex that has in it 10 different herbs. The main ones would be some garlic as a germ killer, some rosemary oil as a germ killer, lavender oil as a germ killer. And those germ killers can do pretty good for Lyme, or they do good for Lyme. There's been some Petri dish experiments done looking at Biocidin LSF. They weren't published, but they show good killing of all three forms of Lyme germ. They show that they remove biofilms. And for Lyme, at least, they block a Lyme defense mechanism, which are called efflux pumps, where Lyme has the ability to develop pumps that literally pump the antibiotics out of the inside, okay? Now, the rosemary oil and the garlic that are in there also are useful for treating yeast, okay? So they can be used to treat yeast overgrowth, all right? The rosemary that's in there may have benefit against Bartonella too, although I don't know that I would use it as a solo agent to treat Bartonella. But in terms of the other products that are in there, I would not think of any of them as having activity against Babesia, okay? All right, I just wouldn't think of it that way, all right? So what could you do to cover your bases? If you're looking for herbs to strengthen the potential of a Bartonella treatment, at a minimum to that rosemary that's in there, I would probably add Houttenia. And it comes as a liquid drop, and you would start at 5 drops twice a day and work up by adding 1 drop per dose every day until you reach 30 drops twice a day. If you wanted to go even further, you might add Sitta acuta to that. Both of these are herbs I got out of Buhner Herbs, for instance, okay? And those two herbs, so Sitta and Houttenia, I find helpful about 70-75% of the time. Prescription options, I find tend to work a little bit better. I find they work about 80-85% of the time, all right? But if you want to go herbal, those are the things I would do. The Sitta, you start at a quarter teaspoon 3 times a day, and you eventually increase it to half a teaspoon 3 times a day, okay? If you want to find this all written down about how I use Sitta and Houttenia, take a look at the Ross Lyme support protocol. In the section in that protocol about how you treat Bartonella, I gave the recommendations on those 2 herbs, all right? And then in terms of an herb that I like using that you could add to this that would cover you for Babesia fairly well, works about 70-75% of the time, it would be Cryptolepis. And I usually start at 5 milliliters of that 3 times a day. And again, that is explained in the Ross Lyme support protocol as well too. Okay. All right. All right. Hope that gives you some ideas. Good luck to you. Oh, LSF, everyone. Biocidin actually has 3 products. There's a pill, liquid drops, and then this thing called Biocidin LSF, which comes in a little pump bottle. The LSF is microscopically wrapped in fat to increase absorption of the herbs into the body. Okay, and I do think that seems to help it actually. All right, thank you for that question. And good luck to you. Hello, Rita. Let's see. Does ashwagandha affect thyroid function, either hyper or hypo? I have read this adaptogen can make hyperthyroid worse. What are your thoughts on this? Thank you for what you do. So we don't have any. So about ashwagandha. So ashwagandha is an adaptogen. It's been used for thousands of years in Ayurvedic, East Indian medicine, also in Chinese medicine. And it's used as an adaptogen in those cultures because it's observed to help when body's under stress. Okay. And is observed to give good energy, for instance, okay? We don't have good human studies. We do have some animal studies. And the animal studies do show better adrenal function, and they show improved thyroid function. I haven't seen any studies to say, so that, improved, the thyroid does a better job of making thyroid, meaning probably it's going to help with hypothyroid. I have used it in my patients that have hyperthyroidism before. I have not found it to increase it, but I would understand in theory what you're questioning there. Okay, all right. And in fact, I use ashwagandha as a treatment for hypothyroidism before I turn towards using medications if I were to need to do the medications. Okay, all right. If you're looking for a whole approach that I have about thyroid, including not necessarily relying on testing, because testing doesn't always determine best whether you have low thyroid. There's a whole article I have on it. And I talk about supplements to help support your thyroid, as well as medicines you can use when you have low thyroid. Let me just do a quick screen share here. This is a pretty detailed article. It's got a lot of depth, a little bit more than I normally put in. But it was actually written to my medical board and trying to explain to them why I do what I do. Even with all the science I put into it, that doesn't mean they necessarily appreciated that. But it's a good background on thyroid. So let me see if I can find that for you. Here it is. So take a look at this article called Hypothyroidism: The Best Tests, Meds, and Vitamins. Okay, that gives you a strong overview of my approach. I even sometimes will work with low-dose naltrexone as part of thyroid management. And for those that might have an autoimmune component, the low-dose naltrexone can be helpful for that too, okay? And I explain that all in this article. All right. Thanks, Rita. Good luck to you. Hello, Robert. Hold on here just a minute. Let's see. I tested positive for band 41 and have all symptoms of Lyme disease with neurologic problems and heart issues. I live in Florida, so it's not very common here, but I would have contracted on vacation. I took hiking. My problem is that my doctor will not treat it. I'm not sure what the next step is that I should take in order to get some type of treatment and relief while living in an area with limited doctors who are Lyme literate medical doctors. Robert, I'm sorry that you're in that type of area. I mean, the one solution you might have, and I know you're in a limited area, is see if you can identify somebody that is Lyme literate. You probably have already done this, but reach out to iLads, ilads.org, and the contact page that they have, you can put a request in to get names of Lyme literate medical doctors down where you are, okay? Short of doing that, you might want to start taking a look at the Ross Lyme support protocol, the basic steps that I built in there, and start trying to figure out, I give you steps in there to treat Lyme, to treat Bartonella babesia. you'll need to figure out whether you have Bartonella babesia, and you can do that by looking at the symptoms. You would take a look at my chapter called How to Diagnose. In other words, you could use my guide based around the Ross Lyme support protocol to start building a treatment that could help you. Okay. You could also, if you're interested, do a visit with me online where I can't prescribe, I can't order tests, but I can give you a good idea what I think is going on and make some specific recommendations for you too. I showed everyone that earlier, but it's on one of the navigation tabs. Actually, I'll show you again here real quick. So you would go to my Treat Lyme site. And this navigation tab right here, this private consultations, click on that. It explains how one of my consults work. So I might be able to help get you on your way with treatment too. But again, if you don't want to do that, feel free to start looking at the Ross Lyme support protocol and add parts that you need. Okay, so take a look at that as well. All right. Actually, let me just, well, I'll look at that later. All right. Good luck to you, Robert. Hello, Katarina. Let's see. Good evening, Dr. Ross. Do you think the foot detox bath will aid in pulling out spirochetes and other pathogens? I probably don't. I don't think so. I know that when you do a foot detox bath, the water turns brown, but I'm not convinced that means toxins are coming out. I think it just turns brown. I'm skeptical of the foot detox bath. Okay. All right. Thanks for that question. Hello, Lynn. Let's see. Curious to know if you heard anything about the redox health system on rebuilding cells. No, I'm not familiar with that. That's something else for me to take a look at. Thanks, Lynn. Hello, Sarah. Can recovery sometimes feel like a relapse? I have nerve damage in my face and head, and it has upheaved lately, and I'm scared of relapsing. All right. So, Sarah, I kind of alluded to this earlier. When somebody's doing better in Lyme and then they suddenly get worse, my first thing that I have people do is make sure it's not a yeast overgrowth in the intestines, okay? So even if you've done a great job with probiotics and you've been on yeast killers as part of your treatment, it is possible, because you're on these antibiotics, that too many yeast will start living in your intestines. And if you start getting too many yeast in the intestines, it triggers the immune system to overproduce cytokines. All right. Remember, I talked earlier tonight, cytokines are what give you most of your Lyme symptoms. The immune system overreaction is what gives you most of your Lyme symptoms. Okay. All right. So, secondly, if you have too many yeast in your intestines, they release a toxin, a neurotoxin called gliotoxin, and that can bring on a lot of the neuropathy too. So, I'll show you an article to help figure out, do you have too many yeast? And I'll show you my article about how to treat too many yeast. But I would consider, do you have too many yeast? Okay, that's where I would start with this first, okay? All right, so I'm going to do a quick screen share here. Okay, so I go back. I'm just going to show you my treatment protocol, for instance, okay? So in the treatment protocol, there's the last section in my treatment protocol is this number 15, which is health decline after doing better, okay? And in here, I talk about this is yeast, consider it to be yeast. It's 90% of the time yeast. It's all explained right there, okay? So to figure out if you have too many yeast, click on this link here, which is called a silent problem, do you have yeast, all right? And for yeast treatment options, look at this article called Kills Yeast, a Brief Guide, okay? All right, now I just got to look at one thing here to satisfy my memory here. Aha, all right. So one thing about my treatment protocol, I'm realizing I don't build in how do you diagnose things, okay? So if you're trying to figure out, do you need to address Bartonella or babesia, take a look at my chapter that says how to diagnose. And again, the article about those two is called "It Could Be Bartonella Babesia: The Signs and Symptoms." All right. And I think I may have to update my protocol so it says point people in this direction so they can figure that out too. All right. I just thought of that. All right, let's see here. Sarah, good luck to you. Hello, Naomi. Let's see. To admin. Hi, Dr. Ross. My 23-year-old son is being treated for Lyme, Bartonella, and Babesia. His only symptoms are intrusive thoughts, OCD, and anxiety. He is being treated with minocycline, Plaquenil, Mepron, and rifampin for 2.5 months. His symptoms are not getting better. He also has high antibodies for Mycoplasma pneumoniae, Epstein-Barr, HHV6. Do you think there'd be any advantage to seeing a PANDAS specialist? Thank you for your help. If he's been on this regimen for 2.5 months, there's two things to consider. Are you treating the right thing? Okay, which would be to look for PANS or PANDAS. The other one would be to try to change around his Bartonella treatment by, I would consider probably adding some Bactrim into this. So his current treatment is for Bartonella is minocycline rifampin. Okay, and although that works often, sometimes to get rid of Bartonella requires 3 drugs. Okay, Bactrim would be a nice complement to the antibiotics that are part of this regimen that he's on already. That Mepron, minocycline, Plaquenil is helping his Babesia. Bactrim added to that Mepron, Plaquenil, minocycline also would help his Babesia. So by adding Bactrim, you strengthen Bartonella, you strengthen Babesia treatment here. Okay, it would be Bactrim DS 1 pill twice a day. And whether your Lyme literate medical doctor looks for PANDAS by doing some testing, or you have a specialist in that area help you consider it, I think it'd be a reasonable thing to think about too. Usually by 1 to 2 months of a good Bartonella treatment, Bartonella symptoms like the intrusive thoughts and OCD and anxiety that your child is having should be starting to get better. But it may just be also that these Bartonella antibiotics are just not effective for his Bartonella, okay? In which case you got to do something to change that around. A simple step would be to add Bactrim into this. All right. Good luck to you, Naomi. Hello, Melanie. Is taking Otoba bark and cat's claw 3 times per day instead of 2 times that much more effective? Are glycerin extracts, powdered whole herbs, or powdered extracts as effective as alcohol extracts? All right, I'm just going to start going through these one at a time. I don't find much benefit in going to 3 times a day from 2 times a day. Some people do get a little bit more benefit, okay? Generally, I find alcohol extracts to be stronger because they extract out in a more intense way the active chemicals. Let's see, which brand form do you think works best for those who cannot tolerate alcohol? I probably would go with a glycerin extract over powders and pills. I have searched your site for the following infections: HME, so basically Ehrlichia and Anaplasma. Are there any herbs you have seen work for either of these co-infections? That's a good point. I probably ought to put something up for those. Generally, if you get on doxycycline for about 1 month, you've taken care of those. I generally don't find herbs helpful for those. Okay? All right. Thanks for that question, Melanie. Good luck to you. Hello, Thomas. Let's see. Good evening, Dr. Ross. I hope you're doing well. What would you do for someone who has a high or elevated reverse T3? My doctor wants to use Cytomel to correct it. Thanks. So with your thyroid gland in the thyroid hormone system, your thyroid gland makes two types of hormones. It makes T4 and T3 thyroid, okay? About 90% of what makes is T4 and 10% is T3. The T4 and T3 go out into the tissues, and within cells, all of the T4 is converted into T3. And what is active inside of your cells is T3, okay? Now, under stress, the thyroid system gets interfered. And what can happen is under stress, the body kind of tries to go into a form of hibernation by slowing down its metabolic processes and its hormonal processes, okay? So what can happen under stress is that T4, instead of going to T3, can be turned into something called reverse T3, right? So T4 has two options. It can either become T3 or it can become reverse T3. So making reverse T3 is like putting a brake on the hormonal system. It's kind of purposely trying to slow your metabolism down so you kind of go into a rest state, if you will, all right? That's how we were kind of designed. All right, so in this kind of a situation, giving more T4 isn't going to help. It's just going to shunt all over to that reverse T3, all right? So the solution to increasing the T3 in your cells, where you're still low thyroid, if you have low thyroid symptoms, is to use the Cytomel, which is T3, okay? All right. I hope that answers your question, Thomas. I think I have some explanation more of that in my thyroid article as well, too. All right? All right. Thank you for that comment. All right, everyone. That's it. I'll take one more here. Hello, David. Let's see. Hello. Been dealing with post-Lyme polyneuritis, stinging, muscle spasms, lots of neural tension. Got any insight? David, there's two things I would consider, okay? So nerves that are dysfunctioning often mean that you've got mitochondria injury. That's going to give low energy in the body, sometimes muscle exhaustion, but also nerves, if they don't have enough energy out of their mitochondria system, cannot heal. You're going to have continued neuropathy, okay? So take a look at my articles that I've written on mitochondria dysfunction and the steps that I say to repair mitochondria, which involves NT factor, glutathione, coenzyme Q10, and acetyl L-carnitine you should add if you are vegetarian, all right? And I talked about that earlier tonight too, all right? Second thing you ought to take a look at is the new article that I just posted earlier today on low-dose naltrexone, which seems to have benefit at treating neuropathies, ongoing neuropathies, by effects that low-dose naltrexone has on a receptor in the brain called a toll receptor on immune cells in the brain, okay? So you ought to take a look at that most recent article. You'll find it at the bottom of the homepage, but you'll also find it in the immune chapter and pain chapter as well too, okay? All right. Good luck to you, David. Those are two things that I would think about doing. All right, so that's it for me tonight, everyone. I've got to get two dogs out who are ready to go home and play. I want to go home and play, and I've got to eventually get working on doing edits to get the video recording up tonight, so my men are up for tomorrow morning. So tomorrow morning, you will get an email from me, and in that email, I will have links to the recording. It's probably going to be around 6:30 or 7 tomorrow, I think, is when I'll probably shoot to have that out to you. Also within that email will be links to sign up for the August series of Conversation with Marty Ross MD. Thanks for being here tonight, everyone. It's been good to see everyone. A lot of new names here tonight, too. In a second here, I'm going to redirect you over to the Treat Lyme site. I'd appreciate it if you'd subscribe and support the writings that I do. It's going to give you a lot of good information about how to manage your illness as well, too. And for those of you that are finding benefit, a number of you expressed that tonight, I'd appreciate if you'd share what I'm doing here with those that you think might benefit as well, too. Spread the word, okay? I'd appreciate that. Good night, everyone.